Hello. I just thought I'd do a video update about our trip to Edmonton, just because it's a lot of information and it's easier just to say it on a video and type it. It would take me 2 hours to type it. So on Monday, we went to Edmonton. Tuesday morning, we had two ultrasounds. So the first ultrasound was just measuring his brain, his head, his stomach, his feet, his kidneys, making sure that everything's okay in there. So everything was good with that. He is a big boy, 5 pounds. They're measuring him at. So he's in the 90th to 97th percentile. He's going to be a huge baby when he comes out, I think, which is good because they said that will help with heart surgery. They said the bigger the better. That's great. I'm a little apprehensive about him being huge, but it has to happen. That's the way he's growing, so that's good. His kidneys are good. Like everything on the ultrasound for him, other than the heart and maybe clubfoot, is great. So the one doctor we said with the clubfoot said that his foot is probably just like at a weird angle, and he's just maybe going like this with it, or you don't know until he comes out. He could just be doing funky things with his foot. So we'll see when he's born. And if he has clubfoot, it's just either like a simple casting to get it straight, or if the tendons are really tight, then it'll require surgery. But it's cosmetic, so it's not like dire need to get done right away. Pigeon toedness runs high in my family, so I'm pretty sure that's just what they're seeing. And my mom taught me how to walk straight. She taught herself how to walk straight. So I'm pretty sure it'll be fine. um, but now the second one was with the fetal echo, so where they only focus on the heart. That one was an hour, and it was great because I took a nap through it. It was an hour for the hour and a half for the ultrasound, and then another 45 minutes waiting and talking with the cardiologist there in Edmonton. So his heart has been upgraded from an interrupted aortic arch to just a coarctation of the aorta, severe though. So the previous one, the interruption, was where the three valves were separated. So only two were connected and one was kind of hanging by himself. The upgraded heart defect that he has is where they're still connected. So all three are connected. The heart is connected the way it should be. It's just the ventricle to go to the three valves is so tiny, tiny, just to the last one. It's like almost pinched. So it just has to be expanded. But that could, they said either he'll have the chest opening or they'll just go through the armpit and balloon it up. They have to see when he comes out to see like if it's still really tiny or if it did grow, because they're doing an ultrasound through me to him. So when he comes out to do an ultrasound on just him will be better information because they can see more, right? Because it's closer. He still has the VSD, so they're going to fix the coarctation of the aortic artery arc. and the VSD, the hole between the two chambers. Um, Now they said there's something to do with his the entrance to the left aortic arch, which is a hole, and it looks like a peace sign normally, but his is just a line. And so the line is just going like this. So they said that they're just going to keep an eye on it. Um, they say that it won't require immediate attention, hopefully, um, but he will have to go to a couple appointments um, just to make sure it's doing okay, which Matt and I expected for appointments for his heart after. I mean, he's going to have heart surgery. Yeah, he's going to need fetal echoes and stuff after. Um, so they said like upwards towards 6 weeks I'll be there, depending on the recovery of him or the severity of what's going on with the surgery. It could be sooner, it could be the 6 weeks. We don't know. It depends all on Gavin when he comes out. Um, when he comes out, they said that we'll be able to hold him depending on what he looks like and what he's presenting when he comes out. He'll need to be put on his special medication within an hour after birth. So, and then he moves from the Royal Alexandra Hospital, where I'm going to give birth to him, to the Stollery Hospital that day. So within 3 hours, he'll be there. Unfortunately, I won't be able to go with him until the next day if I give birth naturally. If I have a C-section, 3 days after, just because I have to heal. Matt gets to go right away. Like as soon as he transfers, Matt can drive down there and see him and make sure he's doing okay and set him up in his little bed and stuff. There will be pictures posted of him after he's born, so he won't have tubes in him or anything after he's born, because we can snap some pictures. You probably see a tube in his belly button. That's for his medicine, his prostaglandin medicine, I think that's what it's called. But they said we could take as many pictures as we want. Now, just to warn people, when we do take the pictures after his surgery, he's going to have a lot of tubes in him. So just to let people know, be prepared. You might see a little Gavin with tons of tubes coming out of his chest and a tube in his nose for breathing and maybe like a feeding tube. But they wean him off tubes per day as he's going. And then they will like start like through his belly button, he'll get his nutrients, like his food, his sugars and proteins and stuff. And then once the breathing tube is out, then they'll start feeding him. Like I'll start feeding him as well. And if he feeds well, then he just goes for a quick transfer to the children's hospital just to make sure that he's feeding extremely well. If he's having difficulty feeding, he'll still be helicoptered over to the children's hospital in Calgary and stay there until he is fully able to feed on his own and can come home. So it could be where I'm up in Edmonton for like up to 6 weeks, and then Gavin comes back, but he's still in the hospital for a little while. So he could be in the hospital for a lot longer. Who knows? Like maybe even till August. We don't know. It all depends on him. I think he'll be fine with his feeding. He's eating pretty good right now, making me eat all the time. But we'll see when he comes out. So that's gonna happen there. They took us on a tour of the Stollery Hospital and the NICU where he's gonna be staying, and it's pretty cool. Like the NICU is a 18 bed area, and your nurse looks after only two babies. So she's focused on two babies, your baby and then another baby, which is good because there is going to be more focus on Gavin, um, rather than having like one nurse take care of a whole NICU. So that's good. And he'll be in a little bed with his monitors, and we can put like pictures up, and we can bring him a little hat or a little toy. He can't hug it, but he can look at it. So that's good. And we can visit him like 24 hours a day. They're open. We can sit with him. They said to come between 9 and 11 every day because that's when they do their rounds. And then they'll let us know on his progress. Um, so that's good. Um, and well, I'll probably be there all the time. And probably just like leave to eat and then sleep, come back. Um, and then Matt will still be coming from Calgary because he still has to work, um, and visit. He'll probably be there all the time and not sleep, just sit there. um, but it's really like clean. You go in there, you have to like wash your hands like a surgeon, like scrub them, and they have a little hang up station for your clothes and stuff like that. So that's good. So hopefully Gavin's surgery is the easy one through the armpit, and we'll just balloon it up. And then, because that'll be, I think, an easier surgery to recover from. And then he starts feeding right away, and then we can take him home before August. He doesn't have to stay in the hospital so long. We also are on the waiting list for the Ronald McDonald House. So hopefully we get in the day that we go there, because they explained how much the hotels would be and stuff, and it's too much money. Like, and then I won't have a vehicle up there, and I'll be alone, and it's better support system for me to be at the Ronald McDonald House, especially since it's only like a 15-minute walk away from the hospital. So I could walk there when I feel better. If I have a C-section, I probably won't be able to, but they have shuttle buses and everything, so um, that's good. So we'll know if we get in right away soon. I'm leaving to permanently be up there May 17th. That's when my next doctor's appointment is, and then they'll set me up with an OBGYN up there. And then, yeah, so like I even think, what if I go up there and 3 days later my water breaks and Gavin's born? So that's why 37 weeks is the optimum time to go up there. Also, if he doesn't come by, I think, halfway through 38 weeks and 39 weeks, I was actually given the option to be induced, and I took that option, just because I'll be full term then, and it's close to his proper due date, and he'll probably be like 10,000 pounds by then. No, he'll be like 8 or 9, so he'll be a good weight. And yeah, they said that that's perfectly fine. I guess they give that option to everybody. So hopefully I don't need a C-section because that's a long recovery. Um, hopefully I can give birth naturally. Also, they said like if Matt is down in Calgary working and my water breaks, he will still have enough time to drive up to Edmonton to see the baby being born because I guess it takes a while for labor. Like it just doesn't happen right away. So I was concerned about that. So they eased my mind at that. Um, and yeah, so that is what's going on with his surgery and the trip to Edmonton and his recovery. We will always get more information when we go up there, um, but that's about it. Uh, so, good news on the heart defect being upgraded from very critical to still critical, but an easier repair, I guess, than the interrupted aortic arch. Yeah, so hopefully everything goes well. I believe it will. No, everything has been going so well so far. Yeah, and then, yeah, so that's about it. Sorry the video is a little long, and I say a lot. I'm exhausted. I'm at the tail end. I'm so tired. But if you have any questions, please Facebook message me. So I'll answer anything the best to my degree and my knowledge. They also gave us this big book, and it's Heart and Soul. So it's your guide to living with congenital heart disease. So it's a big book. It lets you know about, congenital heart defects and coping with the baby's diagnosis and surgery and stuff like that. So that's good to get to have. You can write notes in it and stuff. Um, all in all, it was a great trip. Um, lots of information. Lots of information. So that's about it. But like I said, if you have any questions, please Facebook message me. Yeah. Okay. And we'll keep you updated on any progressions or what's going on in Edmonton. I'll keep you updated. Okay. Bye.